artists whose names you might recognize who've recently battled pancreatic cancer and lost the battle. Singer Aretha Franklin, Supreme Court Justice Ruth Bader Ginsburg, and Jeopardy host Alex Trebek. And now word FSU legend Coach Bobby Bowden. His son Terry talked about the diagnosis after the family announced the 91-year-old Hall of Famer had a terminal illness. Terry said he's tired but in good spirits. We've been preparing for this. We know when you have pancreatic cancer, you're probably talking months, not years. So we know that. We just think we've got some more good days ahead, and we're going to enjoy those together. Joining me on the morning show, Dr. Husain Abbas, a bariatric surgeon with Memorial Hospital. Thanks for being here.
Thank you for having me, Bruce.
So the reality is this disease affects about 53,000 people a year. Unfortunately, most will die within a few months to a year with this diagnosis. What makes it terminal?
So the pancreas, to start off, is a long, slender organ that actually starts just to the right of the sternum and extends all the way to the left. And so, as you can imagine, as it traverses that way, it can cross some major organs and structures. So the problem also is that it's actually further back towards the spine than it is towards the front. And so what that means is that tumors have to get fairly large before we can actually find them. And most of the time, the ones that we find that are curable, that are resectable, are actually done incidentally. So for example, you get a scan done for something totally unrelated, and we find a small mass in the pancreas. The only way, unfortunately, nowadays that we can find those tumors is by the side effects or the secondary effects of these masses. So while we don't know the stage or what exactly is the size of this, but if I was to guess, my guess is there are some major blood vessels that run actually from the intestine, from the lower part of the body, that drain all the blood there, and the pancreas sits right on top of those. So what could happen is that this mass could get fairly large, and what we start realizing, for example, that there might be a blockage from the bile drainage system of the liver, and so the patient starts becoming jaundiced or yellow. And then we start figuring out, well, something is causing this jaundice. What is it? Unfortunately, by the time we get to it, it is so large, it has invaded a lot of critical structures that it is not possible to remove all of these structures and to have a cure. So that is the problem.
It's usually in an advanced stage.
Absolutely.
So I remember talking to a surgeon once, and I said, okay, so why is surgery precluded? And he used kind of a fascinating illustration. He said, think of an oatmeal cookie filled with raisins, and you almost can't get to the cancer.
That is correct. So that's an interesting, picture to draw. But you're absolutely right. What it is actually because there's so many vital structures around. So what we do is we have to remove a portion of that pancreas. But it also depends which side of the pancreas it is, because the pancreas also has parts. If it's close to those major vessels, then it makes it a lot more challenging. And it makes it sometimes, if it invades into these vessels, we may not be able to remove these vessels with it. The operation is just too morbid, and the chances of, unfortunately, the patient not pulling through the operation is just too high for these. And so it depends where it is, and if you're lucky, how big those tumors are. But you're right, the pancreas sits in, it kind of like, it encompasses, almost like hugs major vessels, it hugs the outlet of the stomach. So as you said, as a surgeon described to you, it's very difficult to get to it actually, and also to perform a safe operation.
It usually presents in those who are older, but the reality is that it's often hereditary, which means that if you have somebody who has pancreatic cancer, it may present in the family. So screening is really a key here.
Absolutely. So the trouble nowadays is the best screening tools that we have are usually imaging studies. But it does not make sense to start imaging everybody in the population. If you imagine to get, for example, a CT scan every 6 months to a year, that's a lot of radiation. And we also have to think about the dye that we give the patient. That also has an impact on your kidneys. But if you do have, you're spot on there, Bruce, if you do have a family member who actually has or was diagnosed with pancreas cancer early, you should consider either having endoscopies, which are called, EUSs, endoscopic ultrasounds, or getting scans done fairly frequently to make sure you don't have it.
But aren't there some genetic factors too? Like, I think it's called, a PGV that can show up?
There are some genetic factors, but these are still don't necessarily determine. We're still in the early stage of that to find whether that is the. If you have, say, for example, the PGV, does it actually mean you're going to have a high risk of having cancer or not? So we're still at the early stages of those, and they're not very reliable tests yet. The best way is screening is obviously to try and see if the tumor is there or not. But as you know, these are not ideal screening studies yet.
No, but it does mean you monitor, which is a form of treatment.
Absolutely.
Dr. Abbas, always a pleasure. Good to see you.
Thank you.
Thank you much.